Hey there. So 7 less known symptoms of perimenopause and menopause. So these are actually probably even more surprising than in my last video, a little bit more shocking for some women as to more signs and symptoms of perimenopause that you may not know. So let's dive into it. I'm Dr. Jen, a metabolic and hormone expert, double-boarded OBGYN and integrative medicine. So I actually practice holistic medicine. And let's go into these 7 more symptoms. So first of all, abdominal pain, bloating, constipation, diarrhea, maybe a new diagnosis of IBS. IBS, or irritable bowel syndrome, honestly is a change in the microbiome in the intestine. We normally have a microbiome that has bacteria and fungus and viruses and all kinds of things living in this little harmony. And when we go through perimenopause and menopause, our estrogen progesterone affects the microbiome. There's a particular part of the microbiome called the estrobolome, where estrogen is metabolized. So when you lose these hormones, when they start to decline, then you can have changes in your microbiome. And you may find that you don't tolerate foods that you might have before. You may develop food sensitivities or food allergies. And part of that is also related to the fact that the immune system is present in the gut. Most of our immune system is actually in the gut. So even development of new autoimmune diseases can happen, like Hashimoto's, because of that gut disruption. And women will often say, gosh, I'm getting all this bloating all of a sudden, especially right before my period if I'm having a period. And that is often related to that progesterone decline and these changes in the microbiome. So if you do get diagnosed with IBS, I would strongly encourage you to look a little deeper into why you're having IBS. Is it just hormone induced? Or is it a possibility that you actually maybe have nutrient deficiencies, or maybe you don't tolerate foods like you used to? So number 2, heavy periods. In fact, some women even have flooding, like literally flooding. They become so incredibly heavy and clot. And it's not surprising that the average age of hysterectomy is 45 to 51. And this is because of a term that we don't use in Western medicine called estrogen dominance. Essentially, when you lose progesterone, estrogen thickens the uterus and makes what we see as a period, the blood and stuff inside of the uterus that comes out, which is your period. And so when we have thickening of the uterus and we don't have progesterone around to kind of say, calm down, don't make a shag carpet, make a Berber carpet, then instead you get this thicker amount in the uterus, and so you get heavier periods, clotting. In fact, fibroids are often get worse because the fibroids irritate the lining of the uterus, and then on top of that you have these hormonal changes. Women will notice that their periods may even get, even though they're spaced out, can get very, very heavy and have tremendous amount of bleeding, which then they become anemic. And then the problem even gets worse with heavier and heavier periods. So heavy periods also a sign of perimenopause. Number 3, frozen shoulder. Literally, you go to the doctor and you have shoulder pain and you feel like the range of motion is decreased, and they send you to physical therapy, and yet you really don't seem to be getting anywhere. Frozen shoulder, there's a fantastic article written by Dr. Vonda Wright. In fact, I would encourage you to follow her on Instagram. I don't think she does videos on YouTube, I'm not sure, but if she does, go check her out. Basically, she wrote an article on musculoskeletal syndrome of menopause, which essentially talks about literally the bones, the ligaments, the tendons that change because we lose hormones. And frozen shoulder, I hear that so many times in my clinic. Women say, I went to the doctor because I had this range of motion and pain in my shoulder, and I went through physical therapy, and yet I'm still having pain. Very much related to lack of estrogen. So frozen shoulder, another kind of surprising symptom. Number 4, breast tenderness. So when you were pregnant, if you were pregnant, you had that terrible feeling where you just wanted to keep your shirt off of your body. You did not want it to touch your breast at all. So women can get significant breast tenderness, again, from this phenomenon, which we don't talk about in Western medicine, called estrogen dominance. It's a term that's used in alternative medicine, but not in Western medicine. But essentially, it's perimenopause changes. It's just a term that was created to essentially describe what happens in perimenopause. It can happen at other times in people's lives, but definitely it's with this more estrogen than progesterone ratio, and therefore you get this tenderness that occurs on your breast. There are supplements that do help, other things that can be done besides hormone replacement therapy, and certainly, but it's a matter of recognizing that this is actually a sign of perimenopause and menopause. It can occur, of course, in other times in a woman's life, but it definitely is one of those as well. So number 5, excess body hair. So starting to get little hairs on your chin, on your upper lip, maybe even on your nipples. People can get sort of excess hair in places they don't really want it typically related to androgens, both androgens from the adrenal glands as well as the ovaries. And really, because it's the ratio, right? When we have declining estrogen and progesterone, we still have testosterone that may be around. That kind of mismatch can cause hair growth, as well as what happens in the adrenal glands, sort of trying to make more testosterone. So excess hair. So you kind of seem to be, I hear women say, I'm losing hair up here, but I'm gaining it right here. Not cool. I agree, not cool. Number 6, this is actually related to vaginal health. So as we have estrogen declining in perimenopause, we often have more frequent UTIs, bacterial infections, yeast infections, dryness, overall burning sensation in the vagina. That actually is very common because of the lack of mostly estrogen and testosterone, but certainly it can be for other factors. And so if you find that you're seeming to have more UTIs and BV, and you've noticed some vaginal dryness and vaginal pain during intercourse, that might actually be a sign that you're having some hormonal changes. And kind of related to this, lastly, lack of sensation down in the genitalia. So I often hear women say, feels like things are kind of numb or dead down there, like it kind of went to sleep and didn't wake up. Because you have less blood flow to the genitalia, you have declining estrogen changing the pH of the vagina, and also changing the bacteria in the vagina, like we already talked about. And so women can often have less sensation, maybe even feeling, pain, dryness, all kinds of aspects of that. So that can be actually a fairly common sign and symptom of perimenopause. Hopefully all of these are things that you have heard of. If you have not, hopefully then if you're having these symptoms, I would love if you would talk to your provider about perimenopause and menopause, and maybe what are the solutions that will help for you. I will make some videos individually on solutions for some of these, but please like and subscribe this channel so I can bring you more content, and let me know if you have particular interest in certain videos.